Today we will see about the asthma. It is one of the major condition of the respiratory system. Definition of asthma. Asthma is a chronic respiratory disease. Here, the airways will be affected. It is characterized by the inflammation and narrowing of the airways. What happens if the inflammation and the airways narrowing takes place means it results in difficulty in breathing, wheezing, coughing and the chest tightness. Here, if the person is getting affected with asthma, here what happens in normal lung, we can see the muscles will be relaxed. The normal lining will be shown here and the normal amount of mucus will be appeared as like this. But if the patient is affected with asthma, here what happens? The muscle tightness will be taken place. So the lining will be swollen and excess mucus will be accumulated in this condition. So in case of asthmatic lung, due to the excess mucus and all, the linings will be swollen and inflamed. What is the main etiology of asthma? Mainly due to the genetic factors. If the patient is having any family history of asthma, it is the main important risk factor for this condition. Several genes were identified that are associated with asthma. That genes will be involved in airway inflammation and the immune functions and other factors such as environmental factors. It helps to trigger the symptoms further. Some of the risk factors, some of the environmental factors are allergens like the pollen grains, dust mites and animal dander, like air pollution and irritants such as the smoke and the fumes. Some of the respiratory infections like viral infections such as the cold and flu, and during the stress and some of the emotional factors, the patient is having the further feeling of guilty and alone, it leads to asthma, sudden attack of the asthma. Here what happens, the bronchial hyperresponsiveness and airflow obstruction will be taken place. So due to this different conditions like the genetic and the environmental factors, it leads to asthma. Risk factors of asthma. Mainly we had already seen in the etiology like family history and exposure to environmental allergens like pollen grains and dust mites and all. Exposure to occupational irritants. If the persons are more occupied with chemicals, fumes and dust, or smoking and exposure to second-hand smoke, obesity or being overweight. These are all the risk factors. It further triggers the symptoms of asthma. Here, due to main three reasons, we can observe this condition. Due to the airway inflammation, remodeling and asymptotic high airway responsiveness. ASM tone means airway smooth muscle tone. In this condition, the airway smooth muscle tone will get affected. Due to the allergens, environmental pollution, environmental risk like environmental insults and all, the airway smooth muscle proliferation takes place. It leads to secretion of cytokines, chemokines and growth factors. It leads to the ECM deposition. Whereas in the during the ASM tone airway hyperresponsiveness, due to the contractile agonist, compressed epithelium, developmental immaturity, beta 2 agonist and tidal breathing, deep inspiration. These are all the causes which leads to airway smooth muscle tone, airway responsiveness. And whereas in the bronchial, during the bronchial thermoplasty and all, the ASM mass will be increased. The airway smooth muscle tone mass will be increased. If it leads to further remodeling and all, it ultimately leads to asthma. So these factors mainly plays an important role during this condition. Clinical manifestations of asthma. What are the main symptoms we can observe in this condition? It starts with the cough, wheezing, shortness of breath and the chest tightness. Due to the muscle stiffness and all, these are the things will happen. The types like mild, intermittent, mild, persistent based on the severity, moderate, persistent and severe persistent. In case of mild, intermittent, the symptoms will be less than twice a week. And in case of mild, persistent, it will be more than twice a week. But in case of this moderate, persistent, symptoms once a day will be seen and more than one night per week. Mostly it will be seen in the night. In case of severe persistent, the symptoms throughout the day. Like we can observe continuously and on most days it will be seen, and frequently at the night we can observe these symptoms. How we can identify the asthma? How we can be able to identify the person is getting affected with asthma? First of all, the main clinical history and the physical examination will be seen, like if the patient is infected with any bacterial or viral infections like common cold and flu, or allergic to any pollutants or any other occupational expert, we need to identify the complete family history. They are having, whether they are having any family history due to any genetic exposure and all, we need to identify all we need to collect from the complete history. The diagnostic tests such as pulmonary function tests, PEF monitoring, chest X-ray and the allergy testing. First, in case of PFT, we will evaluate the severity of asthma, whether it is high or low grade, like that we need to identify with the symptoms. The most common pulmonary function test will be spirometry. Here we can observe the amount and speed, how much they are receiving in case of during the inhalation and exhalation, how much the amount and speed of the air will absorb in this PFT in case of spirometry. And PEF monitoring, in this the maximum speed at which the air can be exhaled from the lungs, how much the air was exhaling from the lungs, how much the speed we can able to. In case of chest X-ray, any symptoms such as pneumonia or heart failure, we will identify in this chest X-ray. And allergic testing, it is recommended to identify the triggers. If the symptoms further worsens, what are the triggering symptoms, what that causes the asthmatic attack. So, such as in this, we will go through the skin prick tests and the blood tests. We can identify the specific antibodies that is triggering the asthmatic symptoms. Medical management of asthma. Here, first of all, we need to identify how we can control the symptoms, how we can prevent the symptoms, like by using medications, or what was the severity and frequency. Like we need to mainly focus on this, how the asthma is getting affected very severely, or due to improve that lung function, what all we need to do. The main focus we need to focus on that. First one, controller medications such as inhaled corticosteroids, long-acting beta agonists, and leukotriene modifiers. In case of inhaled corticosteroids, what it causes? It causes reducing the airway inflammation and mucus production. In case of long-acting beta agonists, it helps to relax the airway muscles and it improves the breathing. And third one, leukotriene modifiers. It blocks the actions of the leukotrienes. These are all the controller medications. And second one, reliever medications. These are short-acting beta agonists and the anticholinergics. Here, the short-acting beta agonist works as in the same way like control medications such as long-acting beta agonists. Here, this short-acting agonist helps to relax the airway muscles and it aids in improving the breathing pattern. Whereas in the anticholinergics, it helps to relax the airway muscles and reduce the mucus production. Next, combination antibiotics, like combination medications such as the control medications like inhaled corticosteroids and the long-acting beta agonists. If these combined medications, if we prefer to the patient, it reduces the airway inflammation and relaxes the air muscles. The airway smooth muscle tone will be improved. Surgical management of asthma. Here, if the patient is not responded initially to the medical management, we need to observe for some time. And if the symptoms may get worse than or severe, we need to go for the surgical management. Surgical management involves bronchial dermoplasty, lung volume reduction surgery, and the lung transplantation. In case of bronchial dermoplasty, what it happens, it is a minimally invasive procedure. It's the small procedure. It involves delivering the controlled thermal energy to the airway walls. It helps to reduce the amount of smooth muscle in the airways. It prevents the further constricting and narrowing during the asthmatic attack. In case of lung volume reduction surgery, here the procedure involves whatever the damaged lung tissue or diseased lung tissue is found, we need to remove in this lung volume reduction surgery. If we remove this diseased or damaged lung tissue, it improves the lung function and reduces the symptoms. We can observe mainly in COPD conditions. And ultimately and finally, if the bronchial thermoplasty and lung volume reduction surgery won't work, the client may undergo for lung transplantation. It is the last option for the patients with the end-stage lung disease. In case of severe asthma and we need to go for lung transplantation. Here, it involves replacing one or both of the lungs with a healthy lung from the donor. That the lung transplantation can be life-saving, but it involves more risks and complications. So, we need to take care whether the donor or recipient, the complete care must be taken, and further requires the continuous use of immunosuppressive medications like if the to prevent the further rejection of the transplanted lung. So the lung transplantation involves more risks. Better to go for bronchial thermoplasty or lung volume reduction surgery. Nursing management of asthma. Here we need to mainly focus on how we can prevent that exacerbation, how we can improve the lung function or respiratory function, or how we can improve the quality of life by providing the complete care to the patients. Mainly, the steps involve assessment and monitoring, pharmacological management, patient education, and the lifestyle modification. The assessment and monitoring involves assessing the respiratory status regularly. We need to continuously monitor for oxygen level saturation, any changes in the pattern, and all we need to identify. Identify the triggering factors such as the asthma exacerbations like allergens, irritants, and infections. Second one, pharmacological management. The physician may prescribe the client with the bronchodilators or anti-inflammatory medications. So we need to identify how the patient is using that medications regularly or not, whether prescribed by the doctor they are using or not, they are continued or not, any further effects from that medications like this. Completely we need to identify the intake of medications. Third one, patient education. The patients will use mostly inhalers. We need to teach them how the proper inhaler must be used and what is the medication, how much doses should be placed in that inhaler. Like this, we need to educate them completely and educate the patients how to identify and avoid the triggers, like how to avoid this occupational exposure and all. We need to tell them and we need to educate them completely how they can avoid the exacerbating symptoms or further attacks. Final one, lifestyle modifications. Here we need to encourage and educate the patients to quit the smoking and exposure to second-hand smoking also. Help them to promote regular exercise and a healthy diet in order to improve the health and the respiratory function. So these are all the measures to identify and reduce the asthmatic attack. If the patient is getting affected with asthma, the proper care and management will help to produce the life further. Thank you for listening to this topic. Thank you.